Hello, I'm Dr. Cynthia Gregg, and welcome to my presentation today entitled The Decision for Facial Plastic Surgery is Far from All or Nothing. Patients often express the same questions regarding the timing of facial surgery and whether the procedures can be performed alone or combined safely. Some of the most common questions that I hear are, when should I have facial plastic surgery? What procedure do I need? Do I need to have a big surgery to address all of my concerns? Or does one surgery alone address all of my concerns? I really feel the most important part of any consultation visit is when the patient tells me and then also shows me with a mirror what areas concern them. I can then draw upon my training and my experience to present the various options that they have to achieve their desired goals. A common reluctance in choosing to have facial surgery is the fear of looking different. But it's important to remember that our appearance actually changes every decade because of the aging process. If you look at this slide, this shows an example of someone aging through their 20s, 30s, 40s, 50s, and then 60s. I believe what really happens is that there becomes a disconnect between the way we feel on the inside and the appearance that we have on the outside. And my goal is to help eliminate this disconnect so that a patient feels that they are portraying on the outside how they feel on the inside. Patients shouldn't feel that facial surgery is going to make them look different, but instead know that the natural looking results can reflect better how they feel on the inside. Our goal is not for anyone to know that you had a procedure performed, but instead for them to think that you just look great. There are several surgical options available to us to address a patient's concern. Each option addresses a certain area of the face, and I'm often able to combine many of these procedures in order to individualize the resulting changes in the overall natural appearance. Starting at the top, I can perform a brow or forehead lift, also an eyelid lift or blepharoplasty that can address either the upper or the lower or both. A facelift is actually divided into three parts: mid-face, S-lift, and neck lift. We do perform facial implants, usually to the cheek and to the chin area if it's needed. CO2 laser resurfacing is the gold standard for treatment of acne, scarring, and facial wrinkles. Rhinoplasty is nasal surgery, and otoplasty is ear surgery. There are several factors that result in the changes in our appearance. Our skin thins, we lose elasticity, our supporting tissues in the face deflate and descend downward, and we actually lose bony volume. Since the aging changes start showing up first in the top third of our face, the majority of patients that come to see me are usually first considering having a procedure done in the top third of the face, maybe the brow or the eyelid surgery. This diagram here shows you that you see the skin changes on the left and the descent and relaxation of the muscle and the soft tissues here on the right. And then this is a dramatic picture on the right showing a youthful face on one side and a more mature face on the opposite. As I mentioned, the eye area is often the first place that shows our aging during the aging process. The extra upper eyelid skin and the soft tissue can make us look tired, sad, or angry. This picture here shows the overall benefit a patient can have by having only upper eyelid surgery performed. The photograph on the left is the gentleman preoperatively, and the photograph on the right is 4 months after undergoing bilateral upper eyelid surgery. It's important that patients share with me what really bothers them the most so that I can then address their individual concerns. Now, this is an example of the improvement obtained by performing only lower eyelid surgery. The before pictures are on the left, and on the right are the after pictures of just having lower eyelid surgery. If it's beneficial, I'm going to suggest to patients that they consider performing upper and lower eyelid surgery at the same time. Addressing both the upper and the lower eyelid aging will provide a great overall result to the upper third of the face, while at the same time only undergoing one recovery period. This is another example of a patient before and after having both the upper eyelid blepharoplasty and the lower eyelid blepharoplasty addressed at the same time, and it really resulted in a great overall improvement. It is important to understand that often a low or heavy brow is contributing to the heavy upper eyelid skin appearance. Very few patients will come in asking to have their brows lifted, but it's extremely important to perform an endoscopic brow lift to lift the brow back to its correct anatomical position if indeed it is in a low position, and then I can remove any remaining excess soft tissue off of the upper eyelid during the same procedure. Now this is an example where only addressing the upper eyelid would not have adequately rejuvenated this eye area. This is a patient on the left preoperatively, and then 1 year after undergoing endoscopic brow lift and upper eyelid surgery. Now, a facelift refers to the surgical procedure that will improve the facial aging between the cheekbones and the collarbones. Many surgeons define a facelift as including only the jawline and the neck lift, but I also include a mid-facelift procedure because I believe it results in a more natural, youthful, and less operated appearance. Now this is an example of a patient before and after having a facelift procedure to address the mid-face, the jawline, and the neck. Here's a profile view of the same patient before on the left and 3 to 4 months after undergoing a lower facelift. This is a patient in her mid-50s that requested a facelift, but we also addressed the excess skin on her upper eyelid and performed upper eyelid surgery at the same time. Here's the front view of the same patient, before on the left and on the right is 3 to 4 months after a facelift and upper blepharoplasty. As we age, we often lose bone on either side of the chin, which accentuates the jowling along the jawline. In this situation, I will often recommend a pre-jowl facial implant. This type of facial implant doesn't add any projection to the chin itself, but it augments the bone loss between the jawline and the chin, resulting in a more youthful, natural result. This is the area of concern right here. There's a lot of bone loss here between the chin and the jawline, and by adding a pre-jowl implant, it allows us to get a more youthful, integrated jawline. For some patients, we don't need to perform all 3 parts of a facelift procedure, the mid-face, the jowl, and the neck. This is an example where only a neck lift was needed to address her concerns. Again, on the left is the before picture, and on the right is 3 to 4 months after undergoing a neck lift only. Here's an oblique view again showing the improvement in the jawline and the neck from doing a neck lift only. For patients that want to limit their recovery period, a mid-face lift alone is a wonderful option to rejuvenate the middle of the face by lifting the apple of the cheek upward, which provides a more youthful look while also helping to soften the jowling along the jawline. This is the area of concern, very flat cheek here on this oblique view, and you can see the much more rounded appearance after undergoing a mid-face, and it does help to soften the jowling along the jawline. This patient did not have any jowling at all along the jawline, but she actually benefited from having the mid-face combined with the neck lift. This is an example of a patient who had a very flat mid-face, so we did the mid-face lift. We did not have to do anything to the jowl, but we actually did the neck lift to address the neck bands. I often will recommend combining a mid-face lift along with endoscopic brow and eyelid surgery, since the mid-face lift and the brow lift share the same incision line. This actually helps to rejuvenate not only the upper third of the face, but also extends the rejuvenation down to the middle third of the face. This is an example of a patient who had a brow lift, upper eyelid surgery, but we also did the mid-face lift to help improve the rejuvenation of the apple of her cheek on both sides. So I've shown you pictures of a facelift, I've shown you pictures of a neck lift by itself, a mid-face by itself, and then a mid-face combined with a brow lift. It's also okay to wait to get to a point in your life where the timing is right to just have the brow lift and the facelift performed at the same time. This is an example of a patient before on the left and after on the right undergoing an endoscopic brow lift and the lower facelift, including the mid-face, jowl, as well as the neck. Now this is an example of CO2 laser resurfacing. This is really the closest thing we have to ironing out wrinkles in the skin. It can be performed as a standalone procedure for part of the face or for the whole face, and when I do the whole face, I'm able to include a couple finger breaths beneath the jawline. This is an example before of the lower third of the face with the CO2 laser resurfacing, and you can see the dramatic improvement in the facial skin tone and texture. CO2 laser can often be safely combined with other procedures to help achieve the optimal result. Here, the laser was combined with the facelift procedure to safely resurface the skin surrounding the mouth. I can also combine a laser resurfacing with lower eyelid blepharoplasty to help address the crepe paper wrinkles around the eyes, which are not addressed with the blepharoplasty surgery by itself. Now, the timing of rhinoplasty is important because rhinoplasty should not be performed until the nasal structures are fully mature, and this is usually reached between the ages of 16 to 18 for females, and between 17 and 20 years of age for males. Now, this is a patient in her early 20s, before on the left and after on the right, after undergoing a septorhinoplasty procedure. Here she is as well from the oblique view, before on the left and after on the right. Now, while this is a younger patient, I will emphasize that our nose does change during the aging process. Our nose does not grow, but the skin thins and the cartilage is weakened, and this can often result in a droopy tip, and one of the reasons that I will sometimes do a rhinoplasty for an aging appearance of the nose. 20 to 30% of the time, a chin implant is often recommended to be combined with a rhinoplasty in order to achieve the best overall proportion and balance on the profile view. This shows an overprojected nose with a slightly underprojected chin, and by deprojecting the nose and adding some projection to the chin, we got a much more balanced profile. Now, otoplasty is usually thought to be performed mainly on younger patients. Otoplasty really should not be performed until the ear is fully grown, which usually occurs around the age of 6. My patients currently range in age from preteens up to adults. This is an example looking from behind of a patient who had ears that were protruding on both sides, and 3 to 4 months after having an otoplasty, you can see the ears are in a much more natural position. I also have several patients that have decided to have this procedure later in life because they reached a point in their life where they decided it was time. I hope this lecture has explained the different types of procedures that can be performed separately or together. If you have any questions for me, please send them to the email address below, surgicalquestions@cynthiagregmd.com. Thank you again for attending, and I look forward to meeting you and hopefully helping you achieve your rejuvenation goals. Thank you.